Good morning, everybody. Today, in this session, we will be dealing with definition of terms associated with ADR, that is adverse drug reactions, and the classification of ADR. Then some important topics on the which types of ADR and with their examples. Now, first see what is adverse event first. See, adverse event is nothing but it is an any untoward medical occurrence that may present during the treatment with a pharmaceutical product, but which does not necessarily have a causal relationship with that treatment. But when in case of adverse drug reaction, any noxious change which is suspected to be due to a drug. So adverse drug reaction can be due to a drug, occurs at doses normally used in man, requires treatment or disease decrease in dose or indicate caution in future use of the same drug. Therefore, an adverse drug reaction is an adverse event with a causal link to the drug. See, when we administer the drug, patient develops a new condition or symptom that is known as adverse drug event. So first we will see for whether a drug is involved in this or not, that is drug suspected. If it is yes, we will go through some literature reviews. So we will check the literature, and if it is documented for the product or similar case of the product. So if it shows yes, then highly suggestive of ADR. And if it is not documented in literature, what will happen? Either we will continue the drug or the drug will be discontinued. What if we continue the drug? See, if we continue the drug, it will worsen the symptoms. And what will happen next? Any other possible causes are there. We will go and check for that, like concomitant therapy, underlying conditions, etc. But what will happen if we discontinue the drug? Of course, the symptoms will improve. So it is a positive de-challenge. So what will happen again if we restart the drug? The symptoms reoccur. That is positive re-challenge. Adverse means untoward, unintended, possibly causing harm. That is simply we can say noxious. Adverse event is it can be adverse event, effect, or experience. And ADE means adverse drug event, which happens in a patient taking a drug. Then ADR, that an ADE in which a causal association is suspected between the drug and the event. See here, we can see the difference or the relationship between this adverse drug event and the adverse drug reaction. Here we can say simply one thing, that all adverse drug reactions are adverse drug events. And this adverse drug event is which does not need to have a causal relationship, but obviously in case of adverse drug reactions, causal relationship is suspected or established. See, we can classify this ADR based on its onset of event, types of reaction, severity, and some other classifications also. For based on other categories, it can be classified. So first one is onset of event. It can be classified into again three. First one is acute, that is less than 30 minutes, subacute, that is 1 to 24 hours, and the latent is greater than 2 days. So onset of event in the sense, if you take a tablet or if you take any drug, any form of drug, what will happen? If we are experiencing an ADR within the 60 minutes of the ingestion, that is known as acute. Then subacute within 1 to 24 hours, latent greater 2 days. And in case of types of reaction, that can be classified into type A, B, C, D, E, F, G, H, and U. What is type A? That is also known as augmented. B is for bizarre, C is for chemical, D is for delayed, E is for exit, F is for familial, G is for genotoxicity, F H is for hypersensitivity and U is for unclassified. Severity, minor, moderate, severe, and lethal ADRs. And other classifications are side effects, secondary effects, toxic effect, intolerance, idiosyncrasy, drug allergy, photosensitivity, drug dependence, drug withdrawal reaction, teratogenicity, mutagenicity, carcinogenicity, and drug induced diseases.